Now, briefly first tell us, what is pathology and why is it so important?
Well, pathology is a branch of medicine. We actually normally call it laboratory medicine. I think it's more encompassing than pathology. Pathology tends to suggest disease, and it's not only disease that's involved. So what it is, it's the laboratory component of healthcare, and that's a very crucial component of healthcare, both for patient management as well as for public health. And the NHLS is really the custodian of laboratory health medicine for the public sector of the country. So that's about 80% of the population.
Now, you say it's very crucial. Why is it crucial?
It's crucial in terms of patient care for three reasons. One of them, it sometimes makes a primary diagnosis, where the patient doesn't present with disease, but on laboratory screening, one can pick up disease. For example, cervical smears, for the Papa smears, HIV screening, and many others as well. That's the one component. A second component is to support clinicians and to support the clinical management of patients. And there, of course, it plays a very, very crucial role because the laboratory provides a objective diagnosis of what's wrong with the patient. And thirdly, for the management of the patient. Patients who are on treatment of various kinds, to manage how are they progressing. Are they progressing well? Do they need changes of treatment and so on? That's on the patient side. Then on the public health side, in other words, for the health of the community, the laboratory plays a very crucial role as well. Environmental monitoring, for example, monitoring of vaccine preventable diseases, the susceptibility, and also formidable diseases. Are they in the country? Are they, and so on.
Now, talking about diseases, how significant is your work, considering the disease burden that we do have in our country, and not just in our country, but on the continent as well?
Well, it provides a laboratory support for all public healthcare. So it's the vast majority, in fact, of healthcare in the country. But in addition, there's, if I could mention, the National Priority Program, which is the laboratory support for the HIV antiretroviral program, the TB program, cervical cancer program. These are three critical healthcare imperatives in our country. And the NHLS provides the laboratory support, the underpinning of those programs, which incidentally is one of the largest in the world.
Yes. Now, in relation, and I was talking to you about the continent earlier on, but in relation to the continent, how do we compare in South Africa?
Well, the NHLS really is the largest and probably, I guess, the most advanced and sophisticated laboratory program in the public sector on the continent. It also does supply, the NHLS does supply laboratory service to other countries as well, particularly neighbouring countries on the continent.
Because we've seen the last time from Nigeria, when we had South Africans dying in that church disaster, that some of those were sent through to us in terms of the...
in terms of healthcare, yes, correct, yes.
Now, tell us about your recent prestigious award that you won.
Well, this, I think, was a great achievement. I think it was recognition of the outstanding quality of the NHLS. So it was an award which was made by the Swiss Institute of Quality Standards. That's it's a body based, as its name says, in Switzerland, and it looks after quality management, and in our case, in the healthcare sector. So obviously, its ambit is broader than health, but we won the award in the healthcare sector. And it was an award for really recognition of the quality of the service that the NHLS delivers.
Does that imply international recognition?
It is international recognition, yes, indeed, yes.
Now, what does this kind of recognition mean for the NHL? The National Health Laboratory Services.
Well, it's a feather in the cap for the NHLS. It says to the public of South Africa that the NHLS is delivering high quality, internationally recognized quality laboratory services to support the healthcare system of the country. And I think when NHI comes on board, and the NHLS will hopefully be the preferred provider for NHI, it'll give comfort that the NHI, that the standards of the laboratory delivery is of such a high standard. And it is a high standard. It's monitored by SANAS, which is the local South African national accreditation system. It's also, we have a number of proficiency programs we send out material for, so that all the laboratories are kept up to standard. So I think it recognizes that particular quality of the organisation.
Now, when NSI does come on board, would you have the capability and the manpower as well as the human resource to deal with such an expanded program?
The NHLS at the moment has some 270 laboratories throughout the country. So that's all the academic laboratories of the 8 medical schools, plus district hospitals, plus regional hospitals, plus right the way to the rural clinics. So it's a vast network. It's 6,700 individuals employed. So it's a large organisation, and it's throughout the country at all levels in the country. So yes, and at a high proficiency and quality of service as well.
I asked earlier, how do we compare with Africa, but how do we compare internationally?
Well, I should mention we do collaborate with a number of international organizations, the Center for Disease Control in the United States, the World Health Organization, of course, Public Health England, and many others as well. So they recognize the quality of the service that we deliver. We do have a number of World Health Organization reference laboratories that's cited in the National Institute for Communicable Disease, which is a vision of the NHLS. So we do have international recognition as well.
Professor, once again, congratulations on the award and all the best for the future.
Thank you very much. Thanks for having me.
That was the Board Chairperson of the National Health Laboratory Services, Professor Barry Schoub, in studio with us. Let's now